I want to comment something which is very important. I want to thank Philippe for his beautiful dissections, as ever, and the fact that also he has demonstrated about threads and sutures that the loop technique, as it was advocated more recently, which is an ancient technique from the 1950s, doesn't work at all because they slide through the tissues very easily. So this lady, she wants a correction of the lower part of the face. As you can see here, eventually some of the drooping here, which is important, which is moderate, and here also on the jawline. So the treatment will consist in first I will mark, and then use two threads, the silhouette soft suture, because what I want is to try to reposition this fat here. I have the dissection was very interesting, but clinically speaking, what we can see on the patients are these areas here, and there, and there. And these are fat localization that are superficial. They are the superficial part of very difficult to dissect compartments. They're almost impossible to dissect, but clinically speaking, we can see that. And this is really what I want to achieve, because as a surgeon, I know that pulling the skin alone doesn't work, because skin follows the displacement of the deep fat. So when I do my drawing here, this is the area I want to address. So I'm looking for the efficient pulling point with the cones, okay, which is somewhere in there, and also working with my finger. Okay, working with my finger, that also gives me the orientation of the traction I want to give, something like that. Seems to be okay, right? So that would be the orientation, and for here it would be the same. Pulling point should be somewhere there, and the traction should be there. So I'm going to do straight lines, just straight lines. She has been disinfected and prepped first. I think it would be better if you could come this side. Okay. So what do I mark here with my silhouette soft? So I mark a 5 centimeter mark, not from an eventual exit point, but from the pulling point that I want to be efficient. And then this is my entry. This will be the entry point of my threads, and the exit point will be 1.5 centimeter distal to this area here. Okay, and then the other exit point will be 5 or 6 centimeter upwards there, which would be somewhere here, and I usually draw it like that, and it is the same area. Okay, so this is the marking on one side. I will do the local anesthesia, and then do the marking on the other side. So the small pricks at the entry and exit point, 0.05 of lidocaine with epinephrine, lidocaine or okay. So you don't need to put much, just to anesthetize the entry.
How many you inject? 0.1 cc, 0.2 cc?
0.5 usually.
0.5,
like
and it's
okay.
Lidocaine 1% or Lidocaine 2%?
This is 1% with epinephrine, but it could be 2%. I mean, it's really
okay, with adrenaline or without adrenaline?
With epinephrine, with adrenaline.
Okay.
So that will limit the risk of bleeding from the entry point, which is minor anyway. Okay. And then I will mark the other side, just the same way. Okay. So I can see that what I want to correct is there and here. So she, as I said, she's been prepped once before. Now I'm doing some more of this disinfection of all the areas, because the procedure has to be as sterile as possible. Of course, you don't need to have an operating room, but certainly you really need to try to be as sterile. Not clean is not enough. Okay, because you are introducing a long-lasting product, which is a very efficient one. About efficacy and the aim, as I said, the aim is not so much pulling the skin than trying to reposition the displaced structures, because the knowledge of anatomy and of the deep anatomy and the fat pads has shown us that what happens is that there is a displacement of the deep structure, which is due partly to the loss of volume in the fat, which is due to the muscular permanent contracture due to aging, and which is also due to the changes eventually that there are in the bones. And as we can address...
Dr. Pierre?
Yes?
Just one question. Could you comment a little bit about the difference of length in the threads? Because they have different number of cones, and
yes.
Which one do you select for the patient in the face?
Yes, if there are three different sutures, threads, which I will show you. Can you go down a bit? Down? Yeah, it will be all right. Okay. Three different type of sutures. One with 8 cones, twice 8. 12 cones, twice 6 on either side, because they're bidirectional. I will show them to you now. And these are how they come in a box in this folder. And we have 2 sutures. So to remove it, you just cut this off. Take this off, take the sutures, and then you see the 2 needles, and in the middle you have the cones. And these are handmade. You have these cones, and they slide between the knots, and you have to tighten them first to close the knots. As I said, they're handmade in the United States, and you have just this small preparation. Now, you don't need a lot of material. After. What I need first is, to do the entry point. For that, I use an 18-gauge needle. And what I will create is a small aperture. Can you feel the prick here? Okay? No? It's okay? No. But what I'm creating here is not just a small prick. I want to create a pit, a hollow, so that when I introduce my needle with the thread, it will drop in like a golf ball into the hole. So what I do is just, I don't know if you can see it properly. Now, I will ask my assistant, as soon as I'm ready with my needle. Wait,
Is this an 18-gauge needle?
This is an 18-gauge needle, okay, and this is a 23. So what I'm doing is just sliding down until I reach the pit and fall in it. I don't want to push it at all. I really want to get inside like that. So I start playing golf, and now to push and to stay within the proper plane, which is about 5 millimeter deep, there is a small black dot, as you might see on the needle, which is the 5 millimeter mark, and just stay there until I reach the point. And now, and this, I play the violin on my needle to get it to the exit point there, which I will exit here.
Okay, now you stop, and now don't move.
Just
Everything
to
is
show you
okay.
that this is not in the dermis.
Yes,
I can move freely under the skin.
You are on the superficial layer.
I am on the hypodermis, in the hypodermal
superficial
plane.
hypodermis. So
I'm 5 millimeter deep.
Okay, so let's stay like that. And now, Philippe, could you show exactly where is Pierre?
I'm here.
Exactly in this plane, you see the lateral superficial fat tissue. You see, there's no, you see in that plane here the extremity, okay?
Okay, so it's the superficial hypodermis.
It's the superficial fat, because the deep fat is different. It's below the SMAS. All this part is superficial to the SMAS. It's the third layer of the skin, and it can be very thick. This fat doesn't change with age, or very little, or after the age of 80. It changes with weight, with the weight changes. So now I will just draw my can you close up a little bit? Un poquito más cerca? Bien. And just to introduce very, very simply the cones inside, okay, like that. And you can see that already, if I pull, I have a very strong pulling effect, thanks to the cone, okay? There are many ways, many threads on the market that want to or hope that they anchor properly, but this is really very, very strong anchoring. So there again, I want to fall into the pit and not create another path, otherwise we can have some dimpling. like that, and just...
Wait. Good. We need to see exactly what you are doing. So please explain first your perpendicular insertion, then the fact that you need to turn after the first millimeter.
Yeah, 5 millimeter deep to the black dot, which
Yes.
is on the needle.
Okay.
Then I turn.
Yes.
And then I go parallel to the skin in that in that hypodermal fat, and I can check. I don't know if you can see the movement of the extremity of my needle here that moves freely under the dermis until I reach the exit point here.
Yes,
Okay?
yes, you can. And I think one interesting comment is that you see that he's not using force. In fact, when you really pass the thread, it's more a question of delicacy. You find the plan, you really once you find the plan, there is not too much resistance. So, and I think that this is something that who is starting, especially who is starting to use the threads, to be aware of.
Okay, now I will place the second one. So there again, perpendicular to the skin, I make my aperture here, and then I'll try to change maybe orientation so you can see better, and just try to open the dermis, pulling like that. I block the skin between my fingers, and I really pushing hard to try to open the dermis. And then the second thread, again, here, and I pull over on the cones, on the suture to tighten the knot, and then I will introduce it. I personally prefer to start with the distal part, because this is where I want to apply the tension, the traction, and the other part, and you see this again, it's totally free below the dermis. It's very important. Okay, I reach the point where I want to position my most distal cone and my exit point slightly away here, and make a small fold with the needle cap, and then I can introduce it very, very, very easily in, and you see there again the very strong anchoring. It's just like a drift anchor for a boat or a parachute. It's the surface of contact and the volume which is blocked into the cone that will guarantee an excellent anchoring, which is the most important thing that we need, really. So there again, falling in the pit. Okay, I'm playing golf there. I just want this, otherwise you will have dimpling. Okay, but it's very easy. And there again, staying in the proper plane until I reach the exit point that I've marked, and create a small fold, lifting up the extremity to get that in, preventing that there is any looping at the introduction point, otherwise you might block your needle, introducing the suture like that, very, very simply, and that's it. Now, it's bidirectional, which means that I have one side to position, which is the distal one. I clean now, because afterwards I don't want to move the cones once they're properly inserted. Okay? And now, with my finger, I can feel where the distal cone is until I reach the point where I wanted it to be, which is just there. Okay? Now, if I look at the proximal extremity and I pull, you see this is the effect I wanted to get, the flattening of this area. So with the other side, I will just maintain the position just by pressing, and that is enough to move the cones, and you see how much pulling effect and positioning effect I've got there. I do the same with the other one on this side. You see, I just try to feel where is the distal cone, somewhere there. It's almost where I want to position it, just by pressing gently, and then looking at the proximal end of the suture here, and you see how I can achieve this lifting up. Now, as I said, the skin follows the displacement of the deep structure, and you can see that quite obviously in this area there, on the proximal part, because the skin shows some sort of, not real folding, but it is possible to have some foldings, but that will disappear within a few hours, 2-3 hours usually. Dimpling, if you have dimpling, which is not the case here, will disappear much more, might take a few days, up to 3-4 days to disappear, even in very, very fibrotic skin. So this is done for one side, and if you want to compare...
Yes, could you ask the patient to be on a stand-up positioning, yes, and then we will compare the two
sides.
different sides, the treated side and the non-treated side.
So this is the non-treated side. Let me remove that, so you can see the position and how the fat pad is and the drooping of the skin. And this side, okay.
So stay like that now, and we are going to ask Philippe to make the final comments about the anatomy. So please, okay. Philippe, could you make the final comment about this part of the anatomy?
A last point before Philippe comes in. You can put as many sutures as you want. I've used sutures like Aptos or others, then you need to put 10, 15 of them. There I've just 2, but if I need one more, I can put one more here or another one there. But usually 3 to 4 of these sutures are more than enough to treat the whole face. So the least problems. And if you can get better results because you have a strong anchoring, so much the better for the patients.
Okay, Philippe, your final comment dedicated to the threads, and then we are going to switch to the non-HA injections.
Yes.
Thank you, Benjamin. 1 minute, because I showed you during Pierre Nicolo introduction the position of the thread. So I made the same thing with one thread, and you see here the thread here, you see the action of the thread, the lower part of the thread, and when I pull it, you see the action of the superficial layer, the superficial fat flap with the skin. You see the action of the skin. And this is a sliding plane because there's nothing in the deep part of the fat, in the deep anatomical structures, okay?
Very good.
More you in this good plane, more you will be efficient.
Very good, Philippe.